Welcome to N-Powerment Nursing's test question. Today we're discussing a little bit about hypoglycemia, and it is a select all that apply question. So I'll refer to you above where you can see the text of the body of the question, and we're going to work through it together. So here's the question. The nurse is providing instructions about hypoglycemia to a client with diabetes. Which statement by the client indicates a need for further instruction? Select all that apply. So first I'm going to give the options and then we're going to walk through it. Number 1, hypoglycemia can occur at any time of the day or night. Number 2, I can drink orange juice if hypoglycemia occurs. Number 3, if I feel sweaty or shaky, I might be experiencing hypoglycemia. Number 4, if hypoglycemia occurs, I need to take my regular insulin right away. And number 5, if hypoglycemia occurs, I need to eat something right away and then skip my next meal. So the very first thing we want to do with select all that apply questions is reword them because they're very wordy. So I'm going to read the stem of the question one more time and then we're going to reframe it into something that makes it so much simpler. The nurse is providing instructions about hypoglycemia to a client with diabetes. Which statement made by the client indicates a need for further instruction? What this is really asking you when you look at the 5 options below is which of the following statements about hypoglycemia are false? Because if it requires further instruction to the patient or the client, that means they have that information incorrect. So as we look at each of those questions and options, we're going to treat them as, is this true or is this false? So number 1, hypoglycemia can occur at any time of the day or night. That is completely true. So if the client says that, they don't require further teaching, they're completely understanding. So we're not going to check number 1. Number 2, I can drink orange juice if hypoglycemia occurs. That is true. So if the client says, I would drink orange juice if I'm feeling the symptoms of hypoglycemia, fantastic. That doesn't mean they require further teaching, so we're not going to check number 2. Number 3, if I feel sweaty or shaky, I might be experiencing hypoglycemia. That also is completely correct because we recognize those are some of the main signs and symptoms of hypoglycemia. So that again is true. We don't require any further teaching to our patient. Number 4, if hypoglycemia occurs, I need to take my regular insulin right away. Now, let's think about this. If we understand how insulin works in the body, it takes the blood sugar out of the bloodstream and puts it into the cells. So if they have hypoglycemia, the last thing we would want them to do is to take insulin because that would lower their blood sugars even further. So this is incorrect. This is false. This would require more teaching to that patient if they stated this. So we're definitely going to check number 4. Number 5, if hypoglycemia occurs, I need to eat something right away and then skip my next meal. Some of the main teaching to diabetic patients is that they never skip meals. So this indicates that the client requires further teaching because that is an untrue or false statement. So the correct answer to this select all that apply question is numbers 4 and 5, and that's because those are false or untrue, meaning that patient isn't completely understanding and requires further teaching. So the key to answering select all that can apply questions is what we did right at the very beginning there. We restated them in terms that make sense. So again, the correct way to restate this to make it easier for you to get through those options is to ask yourself, which of the following statements about hypoglycemia are false? So once you learn to reframe those questions, you can better attack those great select all that apply questions. That means you're up there in the high level questions. So that is our question of the day. And for more information on diabetes, you can refer to our complete program. You can see here how we have all these pages on diabetes, the classifications of diabetes, diabetic teaching, and then one of my favorite things to teach, diabetic ketoacidosis or DKA. That's all for today. Please leave your guesses down in the comments and we'll have a great conversation about this. See you next time.